Thanks very much. I'm delighted to be able to be here today to speak to you all. I quickly had to step in at the very last minute for a colleague of mine who wasn't actually able to make it. So I scrambled all of my bits and bobs together, so I'm delighted to be able to talk to you today. So the topic is coping with CLL. I suppose I work as a clinical psychologist in this field, and many of you today obviously have a very clear idea of what it is like to cope with and live with CLL. But really, I think today, the point of today's talk, really I hope is that you can take something out of it today for your own toolbox, something that you might find helpful in something that I say, or something that might trigger a thought process that might be helpful for you in your life and as you're coping and living today. So a couple of the things that I will be looking at is looking at coping styles. I'll be asking people to maybe think about what their coping style is, how they may react to stressful situations that they're encountering and with their illness as they're living it, and the impact of thoughts and actions, and whether they may be effective or maybe they're bolstering you as well as they can be as you're living. And also then the latter part of the presentation is going to be really practical. I've really tried to make it as applicable and as practical as possible, so you can literally take the tips and the strategies that I'm providing that hopefully will be some help. Okay, so just to give you a little background on where I come from, and that I'm not some randomer pulled in off the street to give you some advice today. This is where I work. This is Cancer Care West. It's based in Westside in Galway. Many of you may be already familiar with us. We've been really welcomed with open arms in the community in Galway, and we're very well supported. But this is where we are, and I suppose our primary goal really is to support people with the diagnosis of cancer and their family members. We cater for a huge catchment area. We work with people from up Donegal all the way down to County Clare, so we cover a really huge catchment area, and we provide a huge range of services. So I suppose primarily we have psychological support with a team of clinical psychologists, but we also then provide oncology nursing support in a drop-in basis where you can come into the centre and speak to our nurses who are there every day for any kind of help or advice that you're looking for. We also provide complementary therapies like massage and reflexology. We have drop-in classes that you can attend like yoga, tai chi, relaxation, and then we have monthly information sessions and meetings as well. So there's a huge umbrella of services that we provide. And I suppose my primary role there is to provide psychological support to people with the diagnosis of cancer. And as many of you are well aware, there's a huge range of emotions that you encounter with the diagnosis of cancer. And it really functions on a continuum from very normal feelings of vulnerability and shock and worry and anxiety, up further along a continuum to more serious psychological difficulties like anxiety and depression and panic disorder. And there's a huge level of distress, especially I suppose in terms of in the process of diagnosis. It's a real peak time that we see with distress, but really it can fluctuate throughout, and anywhere between 15 and 65% experience some level of distress, serious levels of distress, when living with the cancer diagnosis. And part of that, I suppose, comes down to a real destabilisation of core assumptions and beliefs that we have about the world and what it's like to live in the world. So all of us today got up, we got dressed, and we knew we'd come down to the Ardalawn today, and we had a general idea of what it might be like to come in and maybe have a cup of tea, sit down and listen to people talk and maybe learn something. And that's how we like to function day to day. We have a general expectation of what's going to happen, and we like when it works that way. And when we get a diagnosis of cancer, all of that is thrown out the window. It completely questions our sense of permanence, our sense of stability in the world, and really brings forward a lived sense of mortality, and causes us to question actually how vulnerable we are, and threatens that sense of safety. So it's really important to acknowledge that this kind of destabilisation of our assumptions is a really important aspect of trying to figure out in the madness of the process of a cancer diagnosis how we're going to cope and manage effectively in that. So it's really important to mention. And I suppose with CLL, there are particular psychological challenges that people have to deal with that aren't necessarily a part of other cancer diagnoses. There's a widely unpredictable course. And Dr. Hyatt referred to the watchful waiting period and the stress that comes with that. You may feel quite well and be told to go on and live your life. You might feel like you should be able to do things and you should do this and you should do that. But really it's very difficult to function when you have this going on in the background. treatment is often aggressive. There are many side effects, as we've already heard today. And even when you're not having treatment, when you're in the process of wondering whether that would be an option for you, that can be very distressing and very difficult to manage. I think awareness and understanding is really important here. So as I've mentioned, I work with a wide range of cancers, and there's a really fantastic inbuilt support framework that comes with lots of different cancers, and particularly probably the most common ones that we would work with, like breast and prostate and things like that. But I think sometimes the blood cancers in particular can suffer from an kind of under recognition and an invisibility that doesn't necessarily have the same reach as other cancers, and I think that can be really difficult to cope with. And it also makes days like today so incredibly important. And the Make Blood Cancer Visible campaign as well. It's just fantastic to have these kind of facilities to be able to get that outreach and increase that societal awareness and understanding. And lastly, but very not leastly, fatigue. Fatigue has come up a couple of times today, and it's a huge, it's often called the secret symptom because you can't see it. It's invisible oftentimes. But I've put it on its own slide because it really has been a huge part of my work and in what I do. And up to 90% of people that have a cancer diagnosis experience fatigue in some way, shape or form. And it's very different to your normal feelings of tiredness. It's really a persistent exhaustion. It can be very difficult to live with. And I don't think many people realise there's a huge emotional fallout from fatigue. It's not just a physical problem. It causes huge emotional difficulties, and it can impair people across a wide range of areas in their relationships and in their work and just in their daily functioning. So there are a lot of challenges to be met when living and coping with a diagnosis of CLL. And if anything, one of the most important take-home messages is every single diagnosis is unique to the person who is going through it. There is no recipe for this. There is no guidebook. There's no rules. You're all bringing in your own personal experiences of what it's like to live with. You're all having your own individual challenges, and you bring with it your own resources, your own personality style, your own experiences. So really, there's no availability here to compare and to contrast because everybody's diagnosis and everybody's experience is different. And I think that's really, really important to remember when going through this. And I'm mindful today that there may be a range of people in the audience, so people who have been living with CLL for a long time, people who have been recently diagnosed, and also family members and people who live with people with a diagnosis of CLL. So I've tried to angle this talk to encompass as many ranges as I can, but really no matter where you are in terms of the CLL trajectory, whether CLL is a small piece of the puzzle that you don't think about or doesn't come into your mind only every few months when you're going for your checkups and your routine bloods, or whether it's the lens that you look at the world through. Every stage and every level has its own type of challenge, can bring with it its own levels of distress, and it's important to acknowledge that. So this is something that I often do with my clients in my clinical work, and it's known as the stress bottle. And I'm going to invite you today to maybe consider what your own stress bottle might look like. So it's just a way of gauging how you're doing right now. So when in the build-up to a diagnosis of CLL, you obviously are bringing with you your own experiences, things that you've gone through already, your own encounters, your own psychological difficulties and stressors that you've had. And they're really important because they're really the foundation on what you're coming into, in the stress that you experience in the build-up of a diagnosis and then following on from a diagnosis of CLL. And they really determine, I suppose, what further resources we have available in order to cope and manage effectively in times of distress. So there's a number of levels on the stress bottle there. So I would just invite you maybe today, even if you sit down and think about, well, what does my stress bottle look like? How am I doing right now? How do I respond to stress? And when you actually consider all of the things that are in your stress bottle, you may not be as surprised as why you do feel levels of stress when you do, or why you feel distressed. So it could just be something to think about. And I think if you're noticing, or if you realise, actually, my stress bottle feels quite full, there's a huge amount going on for me right now, and it actually feels like it's a little bit too much to handle. Well, then oftentimes, even the smallest bit of everyday stress can be the one thing that tips you over the edge and causes that bottle to erupt. So paying attention to what your stress bottle looks like, how you're feeling, how you're coping is really, really important, because if you're tuned into this, then you have an ability to do something about it. And I suppose if you're noticing then that, yes, actually, I'm feeling really stressed and this feels really full, well then, coping strategies that are helpful, applying things that work, that you find useful in times of distress, can almost put a tap on this stress bottle. And it's unlikely it'll be emptied, but at least reduce the level of distress that you're feeling in that moment. So ways of coping. Forgive me, I'm recovering from a cold at the moment, so I might have to take water every now and then. So this is just a number of ways of coping with the diagnosis that people engage in. And this in no way encompasses every one at all, but it is one of the most common that I see in my clinical work. And the first one I have up here is fighting spirit and resilience. And this is a really proactive coping strategy. It's a really get up and go at them type of way of coping. So it's seeking information, it's asking questions that you want answered, it's seeking the relevant supports, and it's learning about and employing strategies that you find useful in order to help you manage and help you cope. So I suppose today's audience is probably a little bit biased in that you're all here today to learn something, hopefully, and pick something up. So everybody here has some element of fighting spirit and resilience about them, which is fantastic. But it really is only one part of the picture. Denial is the next one I have there. And this is one I frequently see in people maybe that are at the earlier stage of diagnosis and are certainly still experiencing some shock. And denial really is, this isn't happening. This isn't happening to me right now. It's different from avoidance. Avoidance is a deliberate decision not to engage in something because it's too stressful. But denial is even a precursor to that. I can't cope. This isn't happening. This is not my reality. Resignation. That's it. What can I do? And helplessness and hopelessness. There's no point. It's all over. And these aren't listed in any particular order. I see all of these in my clinical work. And to be quite honest, there's a place for all of these at times during your own experience and during your own journey. I particularly see the resignation and the helpless and hopelessness when energy is really low and when defences are really low. And I particularly see it again at the earlier part of the journey before people have an opportunity maybe to expose themselves to the information and get to ask the questions that they need answered in order to be able to create a forward plan for themselves. So if you've been experiencing any of these or have experienced or know somebody who's experienced, they're all a very normal part of the trajectory and they all have a place. And there are things that can be done in order to bolster your coping support if you do feel like you're at more of the resignation and helpless and hopelessness aspect. So the first step, and this is often what I'll do with my own clients at work, is I will try to heighten my clients' awareness of their own coping ability. So just asking yourself the question, what is my current response to this situation? How do I manage? How do I cope? When I'm upset, do I go out and seek the people that I need to talk to and air my feelings and express myself? Or am I much more likely to actually isolate myself and withdraw until I know what I'm going to do next or how to cope? Do I tend to engage in behaviours that are maybe not helpful to me? Oftentimes people turn to alcohol, or they'll turn to food, or they'll turn to other coping strategies in order to help them manage to get through to the next step. And if you're unsure about what the answer to that question is, try keeping a diary of your daily mood. It's all about growing and heightening your awareness and your reaction in times of stress. So do you recognise what you look like when you're stressed? And if you do, what do you do? And if you know that, then is that effective? Is it working for you right now? Or is there some changes or adaptations that can be made? So the next step then is I often ask people to think about their stress response or the turning on of the threat switch, okay? So we are all biologically hard driven to look for threat. That is what we are designed to do. It's an evolutionary mechanism that was designed many, many years ago that helped us as a species thrive and survive. So what that means is our brains are really tuned in to danger. They're really tuned into threat. And when we encounter something that's very stressful, like a diagnosis of a serious illness or living and managing with a serious illness, we have responses immediately to that. Hormones, there's a cascade of stress hormones that are released, and there's physiological changes that take part in our body. And if we understand what happens when we are stressed or de-stressed, we have a hell of a lot more power to do something about it once we know what's happening. So our threat switch is turned on. And as I said, numerous physiological changes happen. And some of you might know this as the flight or fright response. So it's often talked about in terms of anxiety research and anxiety management. And what this means is your body just kicks into action. So a number of hormones are released, and things like adrenaline are released, your stress hormone, which is cortisol, increases in your body. And you might start noticing things like your heart rate starts to increase, and your breath starts to shorten and quicken. And you might notice yourself sweating, or you might notice yourself trembling or shaky legs. And systems like your digestive system stop working, and they divert blood to the muscles, so that you are ready to either have the fight of your life or get the hell out of there. So the stress response that you're having when you're going through a really difficult time or are experiencing a huge stressor is similar to an animal fighting for their life. It's the same response that we have. It's the same mechanism that we have. And we haven't really figured out as humans how to come up with a more extravagant idea of how to cope. So this is the way we still manage our stress. So the stress that's felt by this zebra running through the Serengeti for its life is quite similar to the response we're having when we've got work pressures and family difficulties and diagnoses and serious illness. It's really important to understand that, because this is all the subconscious or pre-conscious, should I say, release of hormones that's happening. We're not even aware that it's happening as it's doing. But if we tune into the signs that we are very stressed or the signs that we are struggling to cope, then we have a little bit more information in order to be able to do something to help. So this is the way we're affected then, following this fight or flight release. It affects us in a number of different ways. The body may be one of the most obvious or the most easier to spot, but really, I'm sure there are plenty of people in the room here who can identify with aspects of each of these. In terms of mind, in terms of emotional and mental well-being, worrying, incessant worrying, ruminative thinking, negative pattern thought, not being able to get something out of your head, constantly going over and going over, difficulty concentrating, you're on automatic pilot, you're driving to places you don't even know how you got there. These are all part of the stress response in our bodies. In terms of our behaviour, I mentioned earlier on, people often turn to behaviours that are really maladaptive, drinking more, hurting themselves with various behaviours. They might struggle to eat, they might struggle to sleep. Basic behaviours that are being impeded, which may all increase the difficulty in being able to cope effectively. And then emotionally, just feeling more irritable, or you might feel elements of depression. You might feel really low and apathetic, or constantly on edge, like anxiety, full of keyed up and on edge, never able to relax, never able to calm. So there's a number of different areas that we're impacted in. And if we can tune into the specific components that we ourselves in our individual experience go through, then we can actually do something about it. So the domino effect. So some people may be familiar with this. This comes from CBT, or cognitive behavioural therapy, and it's a way of describing how we respond to the stress response in our bodies, or when we're going through a very difficult time. So you have at the top here a situation. So that would be a stressful situation, a threatening situation, where the threat switch is turned on and our body kicks into motion. So there's a number of different ways this can be experienced. So in response to that stressful situation, we have thoughts. The likelihood is if that situation is threatening and is compromising our security and safety in some way, those thoughts are going to be negative, quite negative in relation to the situation. Those thoughts then have a domino effect on the feelings that we have. They have a direct interplay on our emotions that we have. And as a response, then correspondingly, our behaviour is impacted. All while the physical response to stress is still ongoing. So just to give you a more specific example, when I was asked to do this talk at the last minute, which was a stressful situation. An example of a thought that I had when I was up to my eyes at work was going, oh my God, I'm not going to get this done. I'm not actually going to get this talk done. I don't have time. There's too much on. It's not going to happen. So that would be an example of a thought that I might have. And immediately in response to that thought, I started feeling anxiety. I started to feel panic. Oh my God, what am I going to do? This isn't going to work. You might think logically the thing would be to buckle down and do it, but no. Oftentimes the behaviour is unhelpful, it's maladaptive, it caused me to procrastinate. I moved away from the stressor, I moved away from the thing that was causing me the anxiety, and I did other things that weren't as helpful or weren't as proactive. And all while I was feeling tense, stressed, my tummy was fluttering, I was sweating, all having a reaction to the stress response of this situation. Now, this doesn't necessarily have to happen in this order. They all interplay on each other. So for some people, they might notice, God, I actually feel really stressed. My heart is racing. What's going on here? And then you might go back and go, okay, how am I feeling right now? Or what thoughts are happening in my head? And everybody will be able to identify with a certain aspect more easily than they will with others. Some people find it incredibly difficult to tune into how they're feeling. So oftentimes the body, tuning into the physical body, can be a little bit easier to identify what's going on, and then you can work backwards. But just being even aware of this system, of the domino effect, they all interplay on each other, they all have an impact on each other. And the positive thing about that is that if you intervene in some way in any of these categories, you will improve or aid the other ones. So if you decide to specifically address, for example, the physical reaction that your body has to stress by using relaxation techniques and calming breathing exercises, then you will notice that you see it maybe a greater awareness of, okay, I'm actually doing something that's not helpful here, because it will allow you to calm down and do something a little bit more pragmatic or logical that's helpful in the moment. Does that make sense to people? So, if the first take-home message was that every diagnosis is unique and there is no right way to cope, this is the second thing I want you to take home. You are the most important person in bolstering your well-being when living and coping with a serious illness. You are the only person that is with yourself 365 days a year, 7 days a week, all of the time. If the way that you are speaking to yourself and or the way that you are treating yourself is not helpful or effective, you will suffer as a result. So often we find it's so much easier to find compassion and empathy for other people who are going through a difficult time. But when it comes to ourselves, there's nothing. We take out the should stick, as I call it. I should be doing this, I should be doing that. And we start going hell for leather. We have to start speaking to ourselves and treating ourselves as we would to somebody else who's going through a difficult time. It is one of the most effective strategies you can do to bolster your management and your coping. So, stop putting yourself down. Practice being kind. Practice self-compassion. If you wouldn't say something to your best friend sitting next to you, then why are you saying it to yourself? What is the benefit? What is the advantage to treating yourself so harshly? And this is not taking the easy road. This is not, being soft. This is not being selfish. This is just increasing your awareness about what works and what doesn't work when you're trying to cope with stressful situations. This is a model from something that I've worked in for a long time. It's compassion-focused therapy. And I'm not going to go into it in too great a detail, but really I just think it provides a helpful visual in terms of the threat response and the stress response. So everything that I've just spoken about there, the threat switch going on, all of the ways that we're impacted, our thoughts, our feelings, our behaviours, all of those are what we call the threat system. They're occurring in our threat system. Our threat system is turned on. And the threat system governs really all of our difficult emotions: stress, anxiety, worry, disgust, shame, all of our really, really powerful emotions. The other two systems, our drive system is really useful in terms of moving us towards things we want to get done. If we have a goal, if we know we have an idea of what we get done, we activate our drive system and we move forward. And the last system there is our soothe system, the green system. And the reason I introduce it in this way is the soothe system and the threat system have a really interesting relationship because they balance each other out. And when I talked about the stress bottle earlier, and I talked about everybody has their own stressors that they come in here with, their own past experiences, their own hardships, and you place on top of that the experience of living with a serious illness, it can all be very overwhelming. And our stress response and our threat system can be constantly activated and constantly turned on. And we can almost fall into this sense of being where we're constantly in threat mode. We're constantly feel like we're not on top of things, that we're overwhelmed, that we're not coping. And the soothe system is the system that can counteract this. It can create a balance again. So almost if you think of these three systems as a three-legged stool, and if one of them is constantly being activated and constantly being turned on more, then that stool is just going to tip right over. So it really needs to be about working towards a way of reducing the effect of the threat system, reducing its activation by actively employing techniques and strategies that will soothe us and calm us and bring us some type of peace when we're feeling very distressed. This is just a range of things that can activate the threat system that I've already talked about. So things just like fear, rejection, failure, and serious illness. All of you know this. All of you have had your threat system activated in some way living with CLL. So it's really important to be tuned in to what this can do, because when you're in the threat system all of the time and you're having these acute stress responses ongoing, it has a detrimental impact not only on your physical body, because it acts as an immunosuppressant, so you're actually even more prone to infections and illnesses and things like that, but you're also your mental and emotional well-being. When you're in the threat mode and you're more activated, you have a tendency to have a mind like Velcro for negative events. You tend to pay attention to negative events. I don't know how many people I've worked with that have said when they came in to our support centre, they didn't even think about the word cancer before their diagnosis came, and now it's all they see. It's all they hear. Their threat response is so activated that that's all they're seeing. We give preference to negative events, and we give preference to things that fulfill our core beliefs. So if we feel helpless and we feel hopeless, we will attend to situations and events that prove that that's right. So it's really important to recognise whether you're in that threat system and whether you're activated, and what then you can do about it. So noticing, another take-home message, noticing if you're in threat mode. What does it look like? What do I do? Is it working? And compassion is a really huge, huge piece of this, because when we're struggling and when we're finding it difficult to cope, we are usually the first ones that turn back and go, what is wrong with you? Why can't you cope? Pull it together, for God's sake. Which is ironically the last thing we would say to somebody that we care about who's struggling. So compassion, and more importantly, self-compassion, is huge in terms of developing effective management and coping with CLL. I use this picture a lot in my work. We're really good at minding our phone batteries. We're really good at making sure when it goes down to the red, it's plugged in so it will work the next day. But how often do we pay attention to our own battery? How often do we check in with ourselves and say, actually, how am I doing here? I need to plug in. I need to rest. I need to take a minute. So start thinking about your own well-being and your own care in these terms. I might need to recharge. I might need some time. I might need. And the rest of the presentation really comes down to practical things that you can do. And these will not apply to everybody, and they will not be necessarily helpful to everybody, but hopefully there will be something in it that will resonate with you, that may be something you can introduce or use that may be helpful to you moving forward. And I'm going to start with the basics because they're so important. Start with your basics. Your sleep, your diet, your exercise. They are so important, not only in terms of your physical well-being, but absolutely in terms of your mental and emotional well-being. And there is so much research being done at the moment to the import of nutrition and sleep in particular, in terms of your ability to be able to manage and to bolster your psychological wellness. Also, in terms of fatigue, we mentioned fatigue earlier on. These are the core aspects that you will be told to check in with in terms of managing fatigue. Managing your stress levels. Identifying your sources of stress. We've talked about this already. Checking in with yourself. What do you find the most problematic? What's causing you the most difficulty? And working through that. Thoughts are not facts. Those thoughts that we have in response to stressful events and living and coping with serious illness, they are not all facts. We have thousands of thoughts every day, and they are not all true. I often tell people to treat their thoughts almost like those, those celebrity magazines that you read, where there's ridiculous stories about celebrities. And when you're reading it, there's about 80% that aren't true. And there might be just a sliver of truth in some of them. And that's the critical eye that we need to take to our thoughts as well. Because our brains are designed for threat. They will tell us the worst case scenario. But it is not necessarily true. It's not necessarily factual. So stick with the facts, not with the stories that you concoct in reaction and in response to stress. Try to engage in as many supports as you can. This will be different for everybody, but I would invite you to check in with yourself and say, do I know what activates my soothe system? Do I know what activities to engage in and what I enjoy that helps me feel relaxed and helps me feel at peace? And this can be anything from just having a cup of tea with a friend to just doing things that you enjoy, to doing hobbies, to doing exercise. It will be different for everybody. Being aware of your limits. Anybody who has fatigue will know this is absolutely fundamental. Be aware of what you're able for and what you're not able for. And don't be afraid to say no. Don't be afraid to prioritise your own self-care and your own wellness and stepping back for yourself. Social support. Ideally, this is where people will be able to help themselves the most, is your social support system. It is huge. We are social animals. We need connection. We need to connect with other humans. We need to feel validated. We need to feel loved and listened to and secure. And your support systems are the number one place this can happen. So engaging with people who are dependable, people who are able to listen. There's loads of people that are really good at talking. There's not as many that are good at listening. You need a good listener. You need to be able to find people who you can talk to about how you're doing and not feel judged and not feel that you'll just be told to buck up and get on with it. And you don't need an army. Just one or two key people is all that you need for a support system. And making sure you have some fun. It's really, really important to try and... It can be really easy, I think, to forget when we're feeling distressed and we're feeling overwhelmed that life should be for living. There should be some fun aspect to it. And oftentimes that will take deliberate effort and you'll have to try really, really hard to do it. But prioritising fun and relaxation is really, really important. Cancer does not just happen to one person. And I see this all the time in my work. There's a reason that we cater for people and families of people with the diagnosis is because it does ripple. It's not just one person. There's families, there's loved ones, there's friends, there's the community. So as much as somebody is struggling themselves with a diagnosis, there are people in their lives who are being impacted, and you know that more than anybody. So communication is huge. Taking the time to talking about the difficult things that aren't always easy to say. If you know that you have a tendency to withdraw and isolate and try and cope on your own, maybe doing something to address that. Opening up and talking to somebody that we know will be able to meet us where we are, to able to meet our needs. Someone that we can be honest with, that we can ask for what we want, and to avoid mind reading. There's so much trouble caused by our mind reading and our fortune telling of what is going to happen if we do this. But we don't know that for sure, and communication is the first key. It's the first step in accessing the supports that can help us. I mentioned this earlier on, breathing and relaxation exercises. So this is something that is really useful in counteracting the body response to stress. And there's loads of things online, and some people, I work with lots of people with this, and I'm a huge advocate of this type of work. Some people hate it, some people love it, but it doesn't have to be dramatic and it doesn't have to be complex. So I'll often start with just a deep breath. The power of one deep breath can be everything when you are distressed and overwhelmed. Breathing in for 5 seconds and breathing out. It can just give you the pause that you need in a moment where everything just feels like it's turned on its head. And there's loads of things online, there's relaxation videos, but oftentimes what I find my clients anyway are using the most is meditation apps. So these are very simple, they're very straightforward, they can be downloaded from the Apple Store or the Play Store, and they're just something that people just use to take that moment for themselves as a way of self-care. And the ones that I've included are relatively straightforward to use, but there's loads of things on YouTube as well. But I would invite you to maybe open your mind to, some of you might be already doing it, but to consider the importance of relaxation exercises, particularly if you identified as being somebody who reacts very physically in times of stress. It can be really useful. Different coping styles. So we talked about ways of coping earlier on. These are typically the way coping styles are broken down in the literature. So emotion-focused coping, and this is normally employed when something can't be changed, when the circumstances that we're dealing with can't be changed, but they can be worked through. And then problem-focused coping. And this is really for particular issues that we have that we can address fundamentally. So for example, seeking information. That would be a problem-focused issue. We need information. What are the steps we do to access the information? And we go do it. And the key to coping is choosing the right way of coping for you. There is no one way. There is no one way. You will employ numerous different coping strategies across a wide range of situations. But it's useful to know, am I trying to change something that I have no control over? Am I spending loads of stress and energy and mental time and space on something that I actually can't control, but actually could work through how I'm feeling towards it? So just considering those different ways that may or may not be more helpful. Living in the present moment. So cancer is a disease that takes you way, way forward in the future and as far back as you can go in your head. The last thing it wants you to do is stay in the present moment. It will take you 10 steps ahead of what ifs, what then, what now, whatever. So taking note, if you're going down these rabbit holes of these what ifs, what if then, what if then, what if then, and pulling yourself back into the present moment can be really, really useful and can save or reduce some of that mental energy that you're expending on fortune telling what the future might hold. I talked about comparison earlier on and the uniqueness of everybody's journey, so I won't go too much into that again. And putting your energy into what you can control. Start small, start with the basics, but do something you can control. Don't worry about the problems that you can't. Figure on the ones closest to you right now. Start close in. Trust your own instincts. You are your own expert. You know yourself better than anybody. So you will know if you can cope, if you can manage right now, or if it's a time that you need more. And don't be afraid of owning that, of acknowledging, I actually need more now. I know I can't cope here and I need to reach out. Be honest with yourself about it. And do not struggle. If you don't find that your own social support system is able to contain or manage your stress, then you can reach out further. And I'll talk a little bit about the supports that are out there now, because as Dr. Hyatt referred to, there isn't a huge amount, so it's important to know what's out there. The burden of positivity is something that I see in my work all of the time, and it is the idea or the message that positivity will heal the world. And will heal everything and anything. And if you're not positive, there's no hope. Of course, positivity has its role and has its place and is important. But it is not the be-all and end-all. And you have to allow yourself to have bad days. Everybody has bad days. I have not figured any way of getting around it. People have bad days, and having a bad day or having a bad week or having a bad few weeks will not harm you. It will not hurt you. You're entitled to be sad, you're entitled to feel isolated, and you're entitled to feel lonely. And pushing that away or pretending that that doesn't exist when it really does is actually more damaging in the long run. You do not have to be positive all of the time. But it does have a place. And lastly, resilience. So resilience refers to the inner strength that exists in all of us. And I think this is something that I'm always really struck by in my work, because people are often much, much better at coping than they realise. And they overcome and experience and go through hugely challenging times. And they overcome it. You have the ability and you have the skills to cope. You're doing that now. It's just about heightening the awareness of how you do it and seeing if there's anything else that can add to that can help you and bolster you moving forward. And oftentimes, I've noticed, certainly in my own work, it can provide an opportunity, living with a serious illness, to redefine our values, to redefine what we find important. where we want to go, what we want to do next. And it can provide that different perspective. So just to finish up, in terms of seeking supports and accessing support, as I said, ideally, you're going to be looking and seeking and getting that in your own social support networks. And hopefully today's talk will be able to provide a few more strategies and a few more tips that might be helpful. But if you find, as I said, trust your own gut instinct. If you find that you do need more, there are supports, certainly at Cancer Care West in Westside, and there are more local support services as well, and they are available online. Even Dr. Google will tell you that, but they are available online. So access the support. I'm not sure if people were given any information in terms of psychological supports at diagnosis or anything, were they? Was it a conversation? No. Great. So there are supports out there. It's just about knowing where to access them and what they are. And of course, you can always link with your GP. I've gone through this already, but just to go over, these are the type of supports that we have available. And please don't feel... I think oftentimes people have an idea that they need to be in a certain place or be at a certain stage to link in with services like that, and that's just not the case. We run a drop-in service, so you're more than welcome to come in and have a cup of tea and just see what the service is about even. You don't have to do anything, but sometimes just coming in the door and sitting down and having a cup of tea is enough for where you're at right now. And just to say that every day you are the best that you can be. If you find that you're having a difficult time, if you find that everything is overwhelming or stressful, or you have times like that, try to be kind. Try to slow down and just take it one step at a time. You're doing the best, and that's all any of us are doing in the moment. We're doing the best that we can in what we have to work with in that moment. So just take it slow. And if anything else, irrespective of what stage you're at, of what your experience is, whether you're a family member, whether you've been living with CLL for years or this is a new experience for you, if you focus on yourself and your own, bolster your own ability to be able to cope effectively and manage in difficult times, then you won't go far wrong, because it will be you, no matter where you go from here on forward. And if you're recognizing what your patterns are, if you're recognizing how you respond, and you're paying attention, then your support systems and all of your ability to cope will increase all the more. Thank you so much for listening to me.